Hey, Dr. Joe Show. Thank you guys so much for watching. Make sure you like, subscribe, comment, share. We got a bunch of new subs from the last video. The last video got spicy on aspartame.
I saw that.
Good job on that one, man. You carried it. You were like, for sure, like that was, you can tell you were super well researched. And one of the reasons why we're even doing this episode is to have a more like informal dialogue. And I know you still have a bunch more stats in your head that you can spit out. And we also didn't really get into sucralose as much.
Not much.
Because aspartame took the majority of the video. But what were your thoughts about, or any feedback you've got maybe from the community out there that watched it, or has anyone reached out and said, hey, you know what, like, you should have done this also? Or
I didn't get a lot of specific feedback yet. I think it was kind of dense. So I think some of my friends that did tell me they were watching it, they said, "Oh yeah, I'm gonna have to take some time for this one." So but I did get some feedback from some people, and it was generally positive.
It was all like what I received, and I started sharing it today. We were actually on my Zoom meeting, Latinos in Clinical Research. So I shared the link there, and people started checking it out, and they're like, wow, we didn't really realize like aspartame had all this negative stuff. I mean, people associate it with Alzheimer's, but all the other stuff like the metabolic disorder, people don't associate that with weight gain because it's diet in the name, right? And I guess maybe that's a good segue into sucralose.
Sucralose, where do we begin?
I don't know. Why did sucralose, like, when did it start getting popular?
I don't know. So I know aspartame, we said this last time. Aspartame was FDA approved in 1981. I want to say sucralose was sometime in the 90s, but I don't know exactly. So it is a newer one.
And I know you're speculating here unless you've researched this particular aspect of sucralose, but what's the point of introducing sucralose to foods if aspartame is already adopted by so many? Is it a response to the negative backlash?
Yeah, I think if I were an industry making these products, maybe I would do it because aspartame might sink. So let's have some backup plans, okay? So let's take another molecule, let's completely synthetic, and let's see if this one works. Maybe that's the case with sucralose. I don't know.
What is it about sucralose that makes it so appealing to be used in beverages and in food? And then also what makes it so bad, at least in your opinion, from a clinician's perspective?
Well, the research that you can find on sucralose, the industry-funded research is going to say it's completely safe, and the non-industry funded study is going to say that it's not safe. So that's true, and that's unfortunate. But there is some truth to the fact that sucralose does combat dental caries. So that is one of the marketing points for that. And I don't know if that was established for aspartame, but it was established for both sucralose and acesulfame. And the reason why I mention acesulfame is because whenever you see a beverage that says 0, it usually has sucralose and acesulfame, and they're both sweeteners.
Why? What's the association with 0 and?
That's a good question. We talk about the word diet. Diet generally refers to aspartame.
Right.
So these are the buzzwords where the company knows that that's what it means. But consumers just think, oh, it's better for you. Or, the word diet means, oh, it helps me diet.
Right.
The word 0 means 0 calories, 0 sugar. Therefore, it's helping me diet. So those words are there as a psychological driver. But there's a new word that I've noticed in this last 2 weeks. Carb master.
You
were
texting me.
Master.
You emailed me about this.
Yes, and it was one of my patients who informed me of this. And this is why, folks.
So use that in a sentence. This is like the spelling bee. I've never actually heard this being used.
Yeah, this is why, folks. It's so important to pay attention to your patients. Your patients have way more to teach you than you think. And I'm talking to all the clinicians out there, especially the new ones. Okay, anyway, so Carb Master, it's I don't know.
Country of origin.
First of all, okay, I will say without naming names, it is from a company in the U.S. It's a generic brand, and I saw the word Carb Master on a yogurt cup. And so this patient of mine was coming in for an infection, recurrent infections, and I said, "Are you consuming any artificial sweeteners? Anything? And this person had like a team of people helping them, and they said, no, we're not doing gum, we're not doing these drinks, we're not doing any of this stuff. And finally, I got to, when they mentioned yogurt, and I got to that, and I said, well, what kind of yogurt is it? And they said, oh yeah, it's generic brand, Carb Master, whatever flavored yogurt. So first of all, Carb Master as one single word, that's what it says on the bottle. That's not a word. It's a made up word. Right. So you have carb and you have master. So now you're psychologically driving people to make them think they're mastering their carb intake. And I looked at the ingredients. Sucralose.
No aspartame?
I didn't see aspartame on that one. Yeah. But that one, I believe it had asulfame as well. But sucralose was there. And just to remind you folks, sucralose is basically the sucrose molecule, the disaccharide, and it's been chlorinated with basically Hitler's chlorine gas, the one that Hitler used on people. Now we're putting that on our sugar and we're eating it. That's sucralose. Okay.
So sucrose, which is naturally occurring in fruits.
Yeah, fruits and refined sugar, the white granular sugar that you see.
Cane sugar.
Yeah.
And so it's chemically tweaked.
Yeah,
with chlorine.
Yeah, so there's 3 chlorine atoms that end up on the molecule, and now I think it's 100 or 200 times sweeter than regular sugar.
Interesting, because of the chlorine.
Yeah, the chlorine makes it sweeter. And so again, the industry funded research says it's not absorbed. About half of it is absorbed into your body. Okay.
Half of it. So the chlorine.
I think 40% is.
So when your stomach breaks this down, just in very simple terms,
it doesn't break it down.
That's the main problem.
No.
So what happens?
You just excrete it out. I think you just urinate it out. Yeah.
Kidney metabolized.
Yeah,
liver.
it just goes through. Some of it, I mean, most things end up in your liver, in your bile, or to some degree, and in your urine to some degree.
So both of these things, aspartame and sucralose, from what you know, I've never worn a CGM when I've ingested. I probably should have, like a Diet Coke or a Coke Zero. Does it actually do anything to your glucose spike?
What sucralose does is to your sugar. Okay, so you're asking what sucralose does to your sugar? Mm-hmm. Not okay. So sucralose, I'm not aware of what sucralose does to your blood sugar levels, but it does cause more insulin resistance. There was a study I found about that because it creates that perception of sweetness. It's the same reason that aspartame causes hyperinsulinemic response.
So insulin resistance is basically when the insulin doesn't work as well on the insulin receptors.
Yeah.
Is it actually the receptors that are being impacted or the insulin itself? When they say insulin
I know
resistance.
with aspartame, it's the insulin release. Last podcast we talked about the case of that college student whose IQ dropped when she was drinking tons of diet soda.
Right.
And they did an oral glucose challenge on her. And it wasn't with having just had diet soda. It was after having been drinking diet soda for months. Her insulin levels went way up. And she actually got hypoglycemic from the glucose challenge test.
Wow.
Because her body basically just, instead of using a small tool to make a cut, it's like a giant machete, like chopping through something.
Diet soda, Soda Zero, whatever you're ingesting, still has an effect. It may not have an effect on your glucose, but it has one on your insulin.
The concern mostly I have with sucralose not as much the insulin as much as what it does to your immune system. So
is that different than aspartame, or
it's different from aspartame. Aspartame is terribly toxic. Sucralose is more subtly toxic. But sucralose still adds up. I mean, I've lost count of the number of patients I see with recurrent infections, and all of them, every single one of them, consume a sucralose-containing product on a regular basis. It can be once a day. It can be 7 times a day. One of them that had it 5 to 7 times a day, that person was getting a certain type of infection every 1 to 2 months. And it's when this person saw me that I reoriented their perception of reality, and and I hope
way to put it,
that they have not had many more infections, or at least fewer infections since.
What is it? Usually the similar mechanism, regardless of the autoimmune.
Well, the mechanism is the mechanism's not clear, because the safety studies done on these things, they look at mortality, they look at overtly terrible reactions.
Right.
They don't. The food industry is not interested in long-term effects of these things.
Right.
So the mechanism is unclear. I just know from an article I read. Again, Lucy Hill, thank you for that article. It was that sucralose caused CD8 lymphocytes. Now, that's part of your lymphocyte count. So when your doctor orders a CBC, it's got all these cells in it, and you got your white cells, your red cells, and you got your platelets. Those are kind of the main groups of cells. Your white cells are broken up into a bunch of groups, and lymphocytes are part of that, are a big part of that. That's like your adaptive immunity, being able to fight off viruses, things like that. And you got a lot of CD4 cells and a lot of CD8 cells. So sucralose inhibits not only the ability for CD8s to move, but the ability for them to proliferate. So it shuts down their mobility and their ability to proliferate and divide. So it promotes tumor growth. So if you have a tumor somewhere and you eat sucralose, you're going to make your tumor grow faster, number one. Number two, if you're on sucralose, you're going to be a higher risk for infection.
Because it inhibits the CD4 or CD8.
Or it inhibits CD8 cells.
CD8.
Now, there might be a lot of young people out there who drink Coke Zero, or they put Splenda in their drink, and they say, "Doc, I'm doing fine." Okay, just wait. The sucralose in any product that you're consuming is going to increase your risk for infection.
Wow.
That's it.
So that's through the lymphocytes, which are, refresh my memory, part of the innate immune system, or adaptive?
Adaptive. I mean, you have natural killer cells, but they require some signaling. Your neutrophils are kind of what get activated for a lot of bacterial infections, but and eosinophils are sort of more for allergic responses and parasites.
So CD8 is a subset of a lymphocyte.
A CD8 is a type of your lymphocytes, yeah.
Okay, I gotcha.
Yeah.
And that's the one that's responsible for stopping cells from proliferating uncontrollably. Mm-hmm. And then that's the one that gets CD8 gets inhibited by sucralose.
Yeah, so you're stopping a major branch of your immune system.
Interesting.
Which allows tumors to grow and infections to happen.
And they don't understand the mechanism for why, like,
I don't think that's
because that doesn't happen from sucrose by itself.
Not necessarily by sucrose, but
or at least there's no evidence.
But that's a good question, right? People who have too much sugar, even refined sugar, cane sugar. Now, I don't know about whole cane sugar. I've heard anecdotes about pure cane sugar not being a big deal, and these people having perfect teeth eating cane sugar. I don't know about that, but the refined sugar is a problem, because there have been studies on that. When you have constant sugar intake, your white cells just don't want to do anything.
Right.
So not only do your white cells not want to do anything, you have an excessive amount of glucose in your system from sucrose, and you're promoting infection. This is why diabetics get more infections.
Yeah.
It's because their sugar is high all the time.
And also neuropathy and like nerve damage and things like that.
However, I'm curious, and I haven't done this literature search.
Yeah.
I just thought about this. Aspartame came out in 1981, right? Was neuropathy associated with diabetes before 1981? Does anybody know? I don't know. It's always been associated for the time that I've been in practice and went to medical school. But that's a question I have for next time.
Didn't they have like amputations due to diabetes prior to that?
I think so.
Wouldn't the sugar? So this was my next question.
See, neuropathy and vascular disease, I think they can be mutually exclusive, mechanistically.
I'm trying to play, not devil's advocate, but maybe be moderate in the sense that how do we attribute, let's say, the CD8 inhibition to sucralose and not sucrose? Because I feel like when people see Coke Zero, right, they think they have a free pass. Like, hey, I can drink as many I can drink 12 of these a day. It's better than drinking 1 can of Coke a day. And people, when they have regular Cokes, they're not drinking a 12-pack because they don't feel like they have a free pass. So if someone were to drink like 12 cans of Coke a day, just like they do Coke Zero, would the same outcomes occur as far as CD8 inhibition? Because I feel like the problem with sucralose, aspartame, there's evidence that you presented last video that there's more, but sucralose so far, I see that as maybe the biggest culprit, is giving people a false sense of security.
Yeah, I think there's a big false sense of security with sucralose-containing beverages, particularly ones with the word zero on it.
Do you think that's the real problem with it, or the real problem is its chemical structure?
Well, it's chemical. Everything that we put in our body, I mean, it comes back down to biochemistry. And clinically, I see elevated liver function tests in people who are consuming the drinks with the word zero on it. And when I recheck their liver function tests after cessation, it gets better. Okay, and that's the biggest change they made. Now, soda, regular old soda with high fructose corn syrup, is devastating to your liver. Why? It's because it's all fructose. When you drink regular soda, it goes basically straight into your bloodstream through the GLUT4 transporter. It's not regulated at all the way glucose is. And it goes straight to your liver and turns into fat, like almost immediately. Now, what else has that kind of metabolism that you can think of? Goes straight into your bloodstream, straight to your liver, turns to fat. Does that sound familiar to you? Alcohol. So this is why
Wow.
And doctors out there, maybe you've seen this in the hospital before. You know, a patient comes in with ascites and they're cirrhotic, and there's maybe their chart already says alcohol use, and then the patient swears up and down, I'm not an alcoholic, and then nobody thought to ask them, well, was there ever a time that you were binging on regular soda? I've encountered several of these patients, and all of them tell me, oh yeah, there was a time when I had a 12 to a 24 pack of cans of regular soda per day for like years. Of course, it's going to put you into cirrhosis because it's mechanistically going to create steatosis, steatohepatitis, fibrosis, and then cirrhosis.
Not to mention what it does to your glucose spikes and your insulin resistance at that point too.
Yeah, because it's creating excess fat. Because the problem with, now the fat we store is generally palmitate, palmitic acid, palmitic acid, I believe. So when it gets stored as fat, you know, it takes a lot of, what am I looking for? It takes a lot of electrons bound up to hydrogens in your antioxidants to break down fat and to utilize it. So when you're drinking soda, it's basically going to go straight to fat. It's basically liquid fat. And then it all gets stored up. And these people who have a lot of weight on their body from mostly soda, they can't access their own fat. And when the adipocytes get big and they store all this fat, well, now your cortisol's going up. And when the cortisol's really high, the cortisol causes insulin resistance as well. And then because their cortisol's high, now they're even more hungry all the time, and so they're going to eat.
So when the cortisol gets high, the stress hormone, does it actually block the insulin receptors, or it just interferes with insulin itself?
Well, cortisol is, as a stress hormone, I mean, you could go back to just the cholesterol and how that's kind of the raw material for your steroid hormones. Mm-hmm. It operates on your DNA. Insulin operates on receptors, typically on the cell, and then it triggers some signaling inside the cell. So I don't think it's a direct effect necessarily.
I see.
Yeah.
And so, just a brief overview of what you just said. So, you drink a soda. Not a diet or a zero, but a regular soda.
Any soda with high fructose, yeah.
It does go to your stomach first.
Yeah, you swallow it.
From there, immediately GLUT4, you said?
Yeah, so then as it goes through your digestive tract, it goes through usually GLUT4 transporter, and it just goes right into your bloodstream.
Which goes straight to the liver.
Goes straight to your liver.
Converted to fat.
Gets turned into fat. And then depending on how much you're drinking, it's going to create those big old fat globules. And the more you do it, and the more you have in a sitting particularly, the more damage you cause to your liver. It's the same thing as when people go on an alcohol binge. They do these hits to their liver.
So I wonder why the body releases cortisol. Does it interpret this as stress, and it release cortisol? Or
yeah, I mean, you have these rhythms in your body with cortisol just naturally.
Mm-hmm.
You get
morning.
Yeah, you get the cortisol shot around 3 a.m. and then you get cortisol when you're exercising, and cortisol if something in your life is stressing you out. But if you have a lot of excessive adipose on your body, your baseline cortisol levels are going to be much higher.
So, back to sucralose. Unlike that regular soda,
mm-hmm.
you drink it. There is no GLUT4
mm-hmm.
because there's no.
Yeah, I'm not sure which.
There.
Yeah, I'm not sure. I'm not sure how it gets in exactly,
so
and I don't even know if it gets clipped. I don't know if it gets clipped by your enzymes or not.
So rather than going to your liver and converting to fat, you're saying instead it attacks the body's immune system with the CD8.
Yeah. So you have your immune system all over your body. It's in your blood vessels, it's in your organs, and it's in your GI tract. And some of this does end up getting absorbed by your body, and so if it gets absorbed, your whole body is going to be exposed to it. Now, there's also an effect of sucralose on the microbiome. It actually promotes the growth of Bacteroides and several other bad intestinal bacteria which promote inflammation. Mm-hmm. And it actually decreases bifidobacterium in your gut.
Which, as you guys know, by the way, Life Boost Coffee, right? We're both healthcare ambassadors, mainly so we can buy our own coffee.
Yeah.
But if you want to, you can check it out. The cold brew at least has the bifidobacteria.
Yes, if you cold brew Dr. Livingston's cold brew Life Boost, it's on their website. They sell it as a whole bean, I think. Or it's pre-ground. Yeah. It's pre-ground. You got to do it cold brew. If you put hot water on that stuff, you've basically totally extinguished all the bacteria in there.
Yeah.
So you cold brew it in your fridge for at least 24 hours, right?
I do 24, 24 or 48.
Yeah.
Some say 16 is okay.
So 16.
But I figured sucralose would have a detrimental effect on the microbiome, but so does glucose itself, like excess.
Yeah,
fructose.
Excessive sugar in general. Mm-hmm. And sugar can just be pure glucose. It can be sucrose. It can be fructose syrup.
See, what we really need is a parallel. This will never happen. I don't even know if it's ethical.
Yeah.
But as a clinical trial guy, we need like a parallel study, maybe even double blind, and it's just long-term observational, or you just one group drinks nothing but Cokes, and then the other group drinks nothing but Coke Zero, right?
Yeah. And then another
see
group
if-
drinks Zevia.
Sure, you can do that. Maybe Zevia would sponsor this study.
I would love to put Zevia up against those two others and look at just liver ultrasounds. I dare you guys. I dare the industry to do
Zevia,
this.
let's do it, man. Okay, but as a doctor, as someone that is super knowledgeable on this stuff, what, in your opinion, like the fructose regular soda arm of this study, let's say you extend it out 20 years, versus the sucralose arm, let's say same amount of cans a day. That's the way you'd have to like keep it consistent.
Okay.
Let's say a 6-pack a day, both.
Okay. Quite a bit, yeah.
Do you think there's any differences long term between the two groups? Like, do they both
Yes.
impact the CD8s? They both impact the microbiome? Or what do you think?
No.
What do you think?
Not
the difference is?
necessarily the CD8s. Not necessarily, because remember, so excessive amounts of glucose, I believe, signals lymphocytes to kind of go to sleep. The fructose, I don't know if that signals lymphocytes to go to sleep. The problem with fructose is that it's just empty calories. Now,
So that group would get fatter
they will gain so much weight.
compared to sucralose. If you give them something, they at least won't gain weight.
It depends on, again, you're saying that they're going to drink 6 cans.
Yeah.
I mean, number one, if the person was healthy to begin with, they're probably going to drop out of the study if they know what's good for them. Number two,
Right. This wouldn't be ethical. Either.
it's going to cost, well, of course it's ethical, right? Aren't these drinks 100% safe, companies? Isn't sucralose totally safe? So why don't we do this
Why
study?
don't we do that?
But let's say it is
I'm
ethical.
personally curious.
They're
like
probably going to get really hungry, and they're going to eat other stuff, and they're just going to eat a bunch of fast food, or
Let's
they're
say
going
you
to eat a
feed
lot of.
them the same diet, but the only variable is
So you limit their diet, like you just say, like
normal.
you're going to be limited to this number of calories,
Right.
But then you're going to drink 6 of these drinks, and one of them's going to be 0, and one of them's going to be regular. So
a day for like 10 years.
So yeah, the difference would be frequency. I think there's going to be more infections in the sucralose group, is what I would predict.
Wow.
And in the regular soda group, there's going to be tremendous weight gain. Both of them might see insulin resistance and diabetes and whatnot. Now
what if you had
a 10-year study?
Yeah.
I think there's going to be more tumors in the sucralose group because you've shut down a critical function of your immune system.
And if you added a third arm of aspartame, so Diet Coke,
aspartame,
10 years.
Well, yeah, you're going to have accelerated neuropathy. You're going to have accelerated dementia. You're going to see early onset dementia. You're going to see all the different symptoms, increased ER visits for chest pain.
Do you think you'll see those in the other two groups?
Not as much. If you're drinking excessive caffeine, you're going to have toxic effects of caffeine. Now, chronic and excessive caffeine use, it can present with all kinds of problems. I had the privilege to take care of a patient with this problem at one point, and this patient, first of all, they didn't give me an accurate diet history when I first talked to them, but they met criteria at one point for diabetes insipidus. Then I checked their urine, and it looked like a renal tubular acidosis. And then they were orthostatic. We had to give them fluids. And then after several visits of checking their labs, and it was just so confusing, I'm like, whoa, I mean, your sodium's high, now your sodium's low. They were iron deficient. Their vitamin D was low. So then I started to try to make some connections, try to explain maybe the RTA was because of vitamin D or something. But then after a few visits, the person told me like, oh, well, I probably didn't mention this, but I've been drinking gallons of a super caffeinated beverage, plus other caffeinated beverages on top of that. And I calculated they were on 300 to 500 milligrams of caffeine a day.
And in a regular cold brew,
A regular cold brew coffee, what is that, 80 milligrams, or is it 60?
Mm-hmm.
Is it 60 to 80 milligrams, I want to say?
It was like 200 to 300. This
200
guy might have
300.
been on 3,000.
No, maybe it was more like in the thousands.
Yeah.
Yeah, I think this person was in the thousands. Yeah,
But
it was something.
Like, can is like 200, like cold brew can.
A cold brew is 200 milligrams of
Yeah.
caffeine. Yeah, so I think it was thousands actually. Yeah, I don't
But
think
like multiple thousands.
I don't think of coffee and tea and in terms of like this many grams of caffeine.
Right.
But this person was on like more than 10 times the amount of caffeine per
Wow.
day. It was.
And for chronically long.
Yeah,
period of time.
and they had all their electrolytes were messed. And then once they got off the excessive caffeine, all their symptoms vanished.
Yeah.
Their iron deficiency went away. Everything got better.
Maybe we do another one on caffeine. I have a personal interest in this one.
Of course. I think many people do.
Well, yeah, I'm probably DSM 5 or 6, whatever version they're on.
Yeah, I think they're
Caffeine
working on
addicted. I'm nowhere near 1,000 a day. I
Yeah.
try to keep it under like 600, but
Mhm.
sometimes you go over, but never like in the multiple thousands.
I try to keep it to 1 cup a day for myself.
That's ideal.
Yeah.
But sometimes it's tough, man.
It
when
is.
you're- especially as a doctor. You
You
guys
got
are
busier
up early,
days.
and
I mean, you got busier days
Yeah.
than others sometimes, and
you ever have a day where you don't have any caffeine?
I do on the weekends sometimes.
Okay.
I'll miss a day, but if it
Will you get a headache?
if I go 2 days, I think I usually get a headache. Yeah.
But that's good that you threw in the caffeine in this experimental trial, which will
Yeah.
never happen.
Yeah, I don't think that's ever gonna
First
happen.
of all, it's gonna be super expensive, and
Yeah.
then you have to give people free Cokes and free Zevia.
Yeah, I
someone
mean-
like Zevia would have to sponsor.
I mean, yeah. So yeah, like Zevia, like I think the issue with Zevia is that Zevia already is a little bit more pricey than the other drinks,
Right.
and I think that it just has to do with how much it takes to purify.
But they would
everything.
come out at the end of this study looking like
They
heroes.
would. They would come out looking like heroes for sure. I mean,
But you're gonna get outcomes like naturally, anyways, like just due to our Western diet.
Yeah.
So Zevia drinkers will also probably get diabetes, not because of the Zevia, but
well, I don't
just
think they
because of
would.
living in the U.S.
I don't
no?
think Zevia drinkers would get as much diabetes because first of all,
as much. Okay,
you
yeah.
can't drink too many stevia or erythritol containing drinks in a day because it's going to start to taste weird, right?
You're right. Why does that? Maybe we get into stevia.
Well,
now.
I mean, you folks saw the chemical structures that we put on the screen last time. You know,
if not,
so like
we'll have Daniel put them up.
you
right
got
now.
the glycerol with the 3 carbons, and then you got erythritol with the 4 carbons, and then you got xylitol with the 5 carbons. And then but each of those carbons has a hydroxyl group and OH group on it. So for whatever reason, you consume 1 dose of erythritol, and I'm like, okay, that tastes pretty good. And then you have another one, and like, yeah, it still tastes sweet. And then the third one is like, yeah, this is tasting weird. And then the 4th and 5th one, you're like, oh my god, get you know. But then the next day it resets. So that study we were talking, I don't think the test subjects would tolerate a 6-pack of
six-pack a
Zevia
day.
per day, because they would just say, well, this tastes bitter.
They would drop out.
Yeah, they would drop out because Zevia is healthy because it, number one, it suppresses your appetite, and then it helps you get off of these, toxin-containing drinks, the drinks that have aspartame and the drinks that have sucralose. So I think if we did this study, it would be more of a limited dosage. It would be no more than 2 or 3
Do
of
you
those
think
drinks
we
a
would
day.
need 10 years to see the outcomes, or
No,
You
could
think
see
a year?
You could see outcomes in a year or 2 easily.
from all 3 arms?
All three arms. Because, I mean, I'll never forget one of my biology professors from college. This guy, when I remember, I was a
Who was this
freshman
guy?
at U of A.
Who was it? Patterson?
And it wasn't. What was his name? It was.
Those guys that worked on
He
the
worked
Human
with
Genome
Dr.
Project?
Grimes. He worked with Dr. Grimes. His name, it escapes me.
We probably had the same one. These guys worked on the Human Genome Project.
He has a different balding pattern than me. Anyway, but really nice guy. He worked with Dr. Grimes, and he was a seasoned professor. But he said, I'm on month number 15 of no soda, and he was documenting how much weight he had lost. And he said this to, a freshman class coming into his biology class for the first day.
Probably half of them drinking soda.
Probably half of them are drinking soda. So that's an example of a really good teacher, is somebody who's trying to model the behavior that they're teaching about. And they didn't teach much about, drinking soda, but, fructose and glucose was part of that discussion, I guess. But yeah, he lost several pounds just cutting his one soda out of his life. He was having one soda per day, and I think he cut it back to one soda per week. Mm-hmm. I think he lost like 18 pounds in less than a year or something. So it's pretty amazing.
In the last video you mentioned on aspartame, you mentioned its addictive qualities.
Mm-hmm.
Does sucralose have similar addictive properties?
I've had a few of my patients admit that to me about sucralose. I see a lot more admission of aspartame addiction with the aspartame users. I have heard
because the same caffeine content in a can of Coke Zero versus Diet Coke.
It almost makes you wonder if there's a synergy there. Like the more things you put in there, then they synergize and they become more addictive. I mean, it's like energy drinks. You got taurine and guarana.
I was gonna ask about those.
Yeah, I haven't even
Monster.
All the energy drinks, they all kind of followed this cocktail of taurine, guarana, ginseng, caffeine, and L-carnitine, and then there's newer molecules that I haven't heard of.
But each of those by itself is not bad, right?
Each of those by itself.
I don't know about taurine, but the other stuff.
Taurine's interesting. I need to do more research on taurine, but they're all in the stimulant sort of group. But the only good thing in energy drinks is L-carnitine. And the funny thing was, one of my patients showed me this energy drink that they were drinking, and it didn't have L-carnitine. I'm like, wow, there's absolutely nothing good about this drink.
What about ginseng? I thought that's good.
Oh my gosh. Okay.
Really?
Do you guys remember
those syrup that they sell in LA at the
yes,
flea markets, the ginseng shots?
Yeah, the red ginseng.
Royal jelly.
Yeah, royal jelly red ginseng, those tiny little shots. Yeah. Those are designed to be used at that dose, like I think once a day, or
for
like
30 days.
For 30 days. I don't know how much ginseng is in there compared to energy drinks, but do you remember Pepsi Max?
Yeah, I actually do.
And isn't it kind of interesting how it just sort of vanished? It just faded away out of the market.
Yeah.
That was ginseng laced Pepsi.
So what was wrong with the ginseng?
Well, my theory.
This is news to me. I thought ginseng was
This
good
is
for
just
you.
my theory, is that people were drinking too much of it, and they got toxic effects of ginseng, which is cardiac arrhythmias. And it's not just it's taking it with all the caffeine and then perhaps some other things that these people. But there was enough backlash and bad things happening that they took it off the market. Is my theory.
Ginseng, yohimbe.
Oh, yohimbe.
What's the other one?
That's another one.
Is
that in drinks?
They put them in drinks, so it's like an energy thing.
Oh, yeah.
The other one with the G. It's not coming to me.
It's not guarana?
It might be. There's a couple other things they do in addition.
Something
to
with
ginseng.
cyclic GMP or something.
Yeah, but I always thought those herbs were like not bad for you.
Benign. Well, I know ginseng is used in Chinese medicine, and again, I'm not an expert on this stuff, but folks in Chinese medicine have told me that ginseng is used in very limited amounts for specific patients. You shouldn't just go buy ginseng. I mean, you want to get in big trouble, you take a bunch of ginseng. That stuff's dangerous. It should only be given to you under the supervision of a trained practitioner, ideally in Chinese medicine or some other medicine where they're trained in it.
I did not know that.
And me, I'm not trained in it, so I say don't touch it unless you're under somebody's care who knows how to use it.
I did not know that.
Yeah.
So back to sucralose and aspartame.
Yeah.
And by the way, maybe you don't know, in Monster Zero, they have Monster Zero now, so
Really?
I'm guessing it's sucralose.
Probably. If it's the word zero, it's going to be sucralose. Yeah. Yeah.
So there's a school of thought that we're going to die of something anyways.
Oh, I got patients that say, "Oh, doc, I got to die of something." let me have my this, that. Yeah.
But there's providers that have the same mentality as well.
Yeah, I mean, there's doctors, there's surgeons I've talked to and over the years that don't care.
Yeah.
And they've
said, like, they rationalize it. Like, I'd rather my patient have a Diet Coke versus a regular Coke.
Right. Yeah, because, like, let's say the person has liver disease, let's say, okay, I mean, whatever it is.
They're already in trouble.
Right? It still doesn't hold water because aspartame kills neurons. So these people with diabetes or whatever, they get neuropathy. You pour aspartame on them, they're going to get worse neuropathy. It's like pouring gasoline on a fire. And you want to keep the fire contained. It doesn't work.
Yeah.
So I think the problem is that a lot of clinicians think that every single thing that comes out of our food industry is completely safe. And they think it's safe enough that they can recommend it. And it's just not true. I mean, there are some things where too much of anything is bad, but aspartame and sucralose, they're completely synthetic molecules. Our genome has never seen the likes of these molecules before, several decades ago.
They don't exist.
Yeah, so they really shouldn't exist. I mean, okay, so I can just go make a molecule in the lab, and if it tastes good, and if I can get away with it,
right?
Stevia is not synthetic.
It's not synthetic?
It comes out of the plant.
I see.
You can grow a stevia plant and eat the leaves, and it tastes sweet.
I see.
Because it's got the erythritol in it. Yeah.
I see.
So that's the big difference. And when you just go back to let's just say common sense, right? In biology, we learned that we share a lot of our genome with a lot of other organisms on this planet. I think it's wheat, or there's all these plants, and they have way more chromosomes than we do, and a lot of their genome is similar to ours.
Yeah,
it's pretty interesting. So
it all boils down to basic building blocks of life.
Yeah, it's the building blocks of life. It's looking at patterns, and it's the precautionary principle. Tetrachloro and trichloromethane and chloroform. What does it do to the liver? It causes liver necrosis. So. And what are those things? They're halogenated carbon. You halogenate carbon. That's what sucralose is. It's halogenated. It's got chlorine on it. It goes to your liver. What do you think it's going to do? It's going to be toxic to your liver the same way, but not to the same degree.
Do you think you'll see an increase in NASH? If we
back to that study with the zero group,
yeah.
Non-alcoholic steatohepatitis. Sure, but you're going to see NASH in the soda group too, because that causes cirrhosis too.
Right.
You might see a different pattern of hepatic damage. It's like the difference between Tylenol toxicity and chloroform toxicity, because Tylenol, I believe it's centrilobular, and then chloroform is just the other pattern.
Okay.
Yeah, because Tylenol, it goes through your bloodstream, and then I think chloroform, it goes through another mechanism. So it causes a different pattern of liver damage.
And ibuprofen?
Ibuprofen depletes cells of glutathione. So between, and actually we could talk about the kidneys here. One of the reasons why acetaminophen and is the chemical name ibuprofen? It is ibuprofen. Mm-hmm. Yeah. That's the chemical name.
I always thought aspirin and ibuprofen were the same thing.
Oh no! Oh yeah, absolutely not. Oh yeah. So when you give those two to patients, their kidneys lose glutathione in two different regions. So the medulla and the cortex are each affected by one of those medications, and if you take them both in excess, you will cause renal failure.
So you can't take them both together.
Yeah. So you should not take them both together. That's why we always tell patients alternate your acetaminophen and your ibuprofen. Try not to take them together too much. Yeah.
I have a study, but I can't talk about it. But I'll talk to you about it off camera.
On ibuprofen.
Yeah,
Okay.
it's a repurposed ibuprofen. You know what it is.
Oh yeah.
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 I can say no more, but at least on camera.
Yeah.
What I've come to conclude maybe is, and this providers throw them in the same boat. We humans, we're all patients.
Yeah.
And then providers too. We balance and we prioritize our short-term health goals at the cost sometimes of our long-term health goals. Like weight loss, a perfect example. I want to lose weight in the next year. I'm not worried about my long-term health. I may be worried about long-term health long-term, but losing weight is like my priority in the next year.
Sure.
So if that means cutting out my 6-pack of Coke to have a 6-pack of Diet Coke, and that helps me on my short-term goal, long-term goal, be damned, I'll deal with that later because I'm at least going to be thinner. That's the reasoning, and I think a lot of clinicians do that too. They chase symptoms and they chase short-term.
They choose what they think is the lesser of two evils.
Right.
But you're trading one medical problem for another.
Yeah.
And you're literally experimenting on patients.
So isn't that the clinician's job
but that's the problem. Like you don't realize it's an experiment because you don't realize how toxic the food additives are.
Right.
And again, that just kind of goes back to trust. We trust the institutions of the world to regulate our food. And they're not doing their job.
Well, hospitals are a perfect example of this.
Show me a
hospital.
hospital.
Don't care about your long-term health.
Yeah, and this is something that I started to look into and I didn't get to
they have vending machines in the hospital that sell all this stuff to the patients and the staff.
Have you heard of Blue Zones?
No.
There's some folks told me about this and I started to look it up. But Blue Zones are these institutions that are taking this sort of proactive, precautionary approach to the way they manage their institution in terms of the food and stuff. So I believe Loma Linda, there's part of Loma Linda.
They're Seventh-day Adventists.
Oh, yeah.
So they're super strict.
Yeah, so they're strict. That's part of the Blue Zone thing. So maybe that's just it. But like they don't have soda at all. There's nothing soda.
My other
about
PI in San Bernardino works there, and we used to hate going in the cafeteria because it's just bland. Nothing.
But see, does Zevia break their rules though? If you get an uncaffeinated Zevia drink, would the Seventh-day Adventists be cool with that? Because there's no caffeine.
They'd have to run a study and look at their dogma, re-examine their dogma.
Yeah, they should look at their dogma. I mean, if I were talking to a Seventh-day Adventist, didn't God make biochemistry?
Yeah.
For us to use and for us to use responsibly.
He gave us those plants. I'm glad I learned they were natural. So you brought this for a reason.
Yeah, I brought this. So
liver damage?
Yeah. Well, no.
Or
so
kidney?
Folks, alpha lipoic acid. This is just one piece of how your mitochondria work. It's a free radical scavenger. You can look up the molecule online. It's really easy to find. Just Google alpha lipoic acid molecule. You'll find it. So it's a simple molecule. You'll find it by itself. You'll find it with other supplements. And what it does is it actually can treat neuropathy. Is it FDA approved for neuropathy? No, because it's a natural product. So the FDA doesn't really approve things like that. But there's, this is that study I texted you. There's a study from 1997, 3 weeks of this stuff at 800 milligrams a day. Or was it 800? No, it was at a lower dose. For 3 weeks of this, you can significantly improve diabetic neuropathy. Okay. And I know this is true because I have many patients and friends who started this and they noticed huge change. And then if you take 800 milligrams of this for several months, you can actually partially reverse autonomic dysfunction in people who have that in non-insulin dependent diabetics. Now, what is autonomic dysfunction? It's where people's autonomic nervous system doesn't work very well. Their pressure might drop when they stand up, even though they're not dehydrated.
Tremors, or that's something else?
Tremors. I mean, tremors are a neurological problem, but tremors is like your nervous system. That's like the wiring that's coming out of your brain. Autonomics is like your parasympathetic and your sympathetic nervous system, and you see a lot of folks, usually, older than 40, we could say, usually maybe 60s, 70s. And let's say they have some vascular disease. Let's say that they've had some heart attacks and they already have stents, or maybe they've had a stroke, something. They'll maybe develop this problem where they stand up and they get lightheaded. And so then they go to the ER.
Orthostatic?
And they check orthostatic vitals. And, oh, wow, look, your pressure dropped, 20 points when you stood up. And so positive orthostatics, folks, that's 10 points of a systolic drop when you stand up, or 20 beats per minute of heart increase when you stand up, or when you go from a position change upward, So then what's the treatment for orthostatic hypotension? IV fluids. And the cool thing about that is it confirms a diagnosis and it treats it. Now, you give these people with autonomic dysfunction fluids when they come in and you think it's orthostasis, and they don't get treated well. They don't have the treatment response that you anticipated, and they're still lightheaded after like 2 bags of fluid. And then you kind of scratch your head, and then you wonder, they have autonomic dysfunction, after some other workup. But usually it's because their nerves are damaged, like generally. And if you coat their system with this for like 3 months, you can actually make this problem better. And this is a study from 1997, folks. Okay. And I don't see this being used very much. So
can you use this in conjunction with another favorite of yours, CoQ10?
Of course you can.
Yeah.
Now, with alpha lipoic acid, you ideally want to take it in vacuum. And what I mean is you take it away from other things. Like you take it just with water on an empty stomach. If you're going to use it. And folks, nothing here is medical advice, right?
Oh, yeah.
Talk to your provider if you're going to use this. Now, this can also help lower your blood sugar levels. Mayo Clinic's website even says this lowers blood sugar. Okay. Again, another thing it's not FDA approved for. But I wonder about that mechanism too. But anyway.
So free radical scavenger similar to CoQ10 as far as mechanism of action?
CoQ10.
We did a whole video on CoQ10, by the way. First episode.
Yeah, we did a big video.
Go watch it, guys.
And by the way, I'm trying to get one of the Dr. Langshens on the show. So please, Jens, you or your dad or both of you, you guys are welcome to come on the show. Anyway. Free radical scavenging for CoQ10, I'm not really sure it does that. CoQ10 really kind of helps with your blood vessels functioning properly because, like I said, it's ubiquinone. It's ubiquitous. It gets into your membranes, and it greases that electron transport chain with that quinone group.
And then this, besides the neuropathy, like for healthy people, what would it do? Just prevent neuropathy? Or?
It's an essential nutrient. I mean, everybody needs it. Mm-hmm. See, and then this discussion, it's baby steps towards something called functional medicine, which is where you're trying to get the optimal function out of your body with optimal nutrition and exercise and lifestyle. That's really what I think functional medicine is supposed to be about.
Promote proper glucose metabolism.
Yeah, I mean, it's on the bottle.
Yeah.
It promotes glucose metabolism. I give it to patients for neuropathy, though. Because
can function in both water and fat environments.
Yeah. Yeah, I mean, it's not hard to get. So talk to your doctor about alpha lipoic acid.
Man, I think we need to do more discussions on these things. Maybe the next one on stevia a bit more, and
I think
we didn't touch on in this one.
Man, I mean, there's just there's all these question marks I have. I mean, I'm curious as to the epidemiology of diabetic neuropathy before the advent of aspartame. I'm curious how prominent it was before and after. So that's something that we can look at, and more toxicological studies on stevia. I mean, I'm interested in finding negative studies on stevia. I want to find some negative studies, but I couldn't find any.
Yeah.
I had trouble finding. So if folks start commenting, I mean, if you find a negative study on stevia, please post it below, or at least write the title. YouTube kind of blocks links to NIH articles for some reason. They don't like links to legit place. I don't know. It's weird. NIH has a lot of resources. But
oh yeah, they do. Okay. I mean, yeah, I think we're still, a lot of these conditions started happening, especially obesity, in the age of excess, right? Fast food had a lot to do with it.
Yeah.
Soda and then artificial sweeteners soon followed. And
yeah.
even the stuff we discussed earlier about sucralose. I mean, maybe the issue is, well, people think it's a free pass, so they can have a 12-pack a day because it's zero.
Because it says 0, yeah.
And the reality is it's a lot more complex than that. I guess that's a fair conclusion or cliffhanger.
Yeah.
Till next time.
Yeah, until next time, I suppose.
All right, guys. Like, subscribe, and please subscribe, comment, and then share. Please share, and let us know in the comments what you'd like us to cover next. Is it ALA? Maybe we can do a whole hour on this.
We could maybe do a whole hour on ALA, because
I want to do caffeine, though, at some point.
Yeah, caffeine.
That one's gonna hit too close to home.
A lot of
I
people
walk out during that one.
A lot of people have done caffeine. I think Joe Rogan, he talked to some guy about caffeine this one time, and like the guy went off of caffeine for several months, and then he had a cup of coffee, and he said it was like a psychedelic experience.
Dude, I'm such a huge fan. I had this idea. I don't think I'll do it right now, but to write a book on the history of caffeine and all the innovations that it's responsible for. That's a lot.
Well, yeah. I mean, the Renaissance. One theory as to why we had the Renaissance was we got cleaner water by drinking tea, and we stopped drinking so much alcohol. And so productivity went up because people were not drinking as much grog. I don't know.
So let us know in the comments what you guys want to see next. Caffeine, ALA, something else, more aspartame, stevia. Let us know, guys, or anything.
Yeah.
Like, subscribe, comment, share. Thank you, Dr. Joe.
Thank you.
Bye-bye.